So today we have the pleasure of speaking with Jeff McNairy, and he's one of the founders of Rythmia, Awaken to Miracle Center, and he'll be discussing some of the integrated programs that he has to help people with a wide variety of neurological disorders, from addiction to other issues like anxiety. So, Jeffrey, thank you for being here, and let us know a little bit more about the Awaken centers that you have and some of the work that you're doing.
Yeah, thanks for having me. So I come from a traditional Western background of medical care, coming from UCLA Med Center. What I was realizing in a Western framework of people that struggle in therapy or in medical treatments with addiction or trauma or depression or anxiety is that eventually they plateau and they never really get to the bottom of what's driving their problems, their mental health issues. So we opened a facility in Costa Rica that really addresses those issues, and we use a plant-based program, and the indigenous medicine we use is called ayahuasca, and we're medically licensed by the Costa Rican Ministry of Health. So we have a lot of doctors and nurses and paramedics and healthcare people that work here, but we have a blend also with shamans and holistic practitioners in a very effective program that we've seen almost 14,000 people through the doors since we opened in 2017.
Wow, that's amazing. So these are really innovative therapies. Now, these aren't currently offered in the United States, correct?
Correct. The reason why ayahuasca is not allowed in the United States is because it is considered a Schedule I substance by the Geneva Convention in the early 1970s, which means that most of the world believes that ayahuasca, or the active ingredient in ayahuasca, which is dimethyltryptamine, or they call it DMT, they believe that there's no known human benefit or that it is harmful to humans. Now, that's an old school belief because there was no research done on it and really no bridge into sort of a modern program that could help kind of explain it, understand it. So Costa Rica is more open to it because there's indigenous connections in this country to the plant medicine, and it's been allowed to be given to clients that qualify medically. And not everybody qualifies, obviously, but there's certain requirements. But yes, it's the reason it's not in the United States is because it's not licensed yet. It's banned. Actually, it's a banned substance. What's happening is the plant medicine is allowed to be absorbed into the body because they drink it. And what allows the absorption is the monoamine oxidase inhibitor component of the medicine that allows the dimethyltryptamine to go into the bloodstream. And what happens is it opens up channels neurologically and helps people connect their amygdala with their prefrontal cortex in their brain, which allows for processing of historical trauma. And the way it happens is through visualization, memory retrieval, and an emotional release. So there's a serotonin agonist protocol that begins with a 5-HTP sort of interaction that allows people to have these sort of connections. And the interesting thing is that dimethyltryptamine is naturally occurring in the human body. So when you give yourself a little extra, it enhances what DMT is for. And there's all these theories about, why do we have this in our body? But one of the reasons is to have connection with self and connection with others.
So do you see a wide range of patients across the spectrum, or is there one particular area they seem to come from?
Well, we have a very international crowd from all over the world. The common theme is that most of these guests have trauma of some sort. And there's a wide range of people that have psychiatric history that's not severe, because severe psychiatric history is contraindicated with this medicine. But generalized anxiety disorders and major depressive disorder, those guests do very well when they come. Also, the trauma sort of background, which most of these people all share, whether it's through addiction as a coping tool for trauma, or veterans of the military do very well with this plant medicine. And the VA is actually starting to look at it a little bit in the U.S. to kind of see like what they can find out about it. Because every veteran that we have that comes through here does amazing, and they get rid of their PTS, which is a big issue right now with the vets.
Absolutely. So tell us about your participation at the HEALinc conference and some of the things you'll be doing there.
I'm going to speak at the summit in the Bahamas in April about trauma and the modalities of healing for trauma, and the way that this plant medicine that I've become familiar with through the last 8 years, how it's helped me with my own personal trauma and also helped many other people through the neurochemical responses that it creates, but also through the emotional sort of connection that people can have. And I'm going to talk about how people get overwhelmed in life and why. Also about all of us have what we call a dissociative split from the self that happens between the ages of 2 and 7 years old. 7 years old, most people will have this event that happens where they feel that it's unsafe to be themselves. Oftentimes it's based in trauma, abuse, neglect, abandonment, or if parents were around and helpful and loving, then it's based sometimes just on misunderstandings of children. And so we can have these sort of themes in life that make us believe that, we don't deserve to be happy, or, have led to anxiety and depression and eventually addiction. So I'm going to talk about what that all means and how this program that we have at Rythmia is addressing those very specific issues to give people success. And a big part of our program is self-empowerment and independence and ability to make decisions that are based on their own sort of healing that they were able to accomplish themselves.
Well, excellent. Well, thank you so much, Jeff, for taking the time to talk about Rythmia, and we'll look forward to seeing you in the Bahamas in just a few months, and hopefully we can learn more about what you're doing and feature you again on Boston BioLife.
Excellent. Thanks so much for having me, and I look forward to seeing you also in the Bahamas. It'll be a fun time.
Absolutely.